Guys, it's Debbie Potts, and I just wanted to do a short video on a rabbit hole deep dive to understand more about science behind red light therapy. I'm always curious about how does that work? What does the research share? Whose research studies done on? So looking into red light therapy as it is suggested to benefit our mitochondria. I continue to share on this video channel, the podcast audio version as well, how we can improve how we age to be our best self in the future, being fit and healthy from the inside out at a cellular level. So, working on metabolic health, metabolic flexibility is really coming down to our mitochondria. So, a lot of M words. We want to really work on thriving as we age and not struggling to survive. With that, I'm on a mission to improve mitochondria function. NAD plus we'll talk about a little bit more, but today I want to share some information on red light because I have red light devices and I have an infrared sauna that's near, mid, and far sunlight and sauna. So what does it do as I'm trying to work on my mitochondria and also skin health? So a few different items. There's Therasage. They have a bunch of different devices, but red light therapy, they have pets can get their own device, all sorts of different masks, pads, all sorts of. So, what is the big deal about red light therapy? Do you wonder that? So, I want to dive into all right, is it a trend? Is there a reason for it? Do we need it? Do I just look outside, be outside at sunrise and sunset? Omnilux kept showing up. So they have different face masks similar to my higher dose mask. And to learn, how does it help anti-aging, anti-acne, topical skincare? So if we look at the research, want to look at scientific advisory board, looking at research on each person's website, I'm finding this funny. A lot of the people that are in those ads are like 20, 30 years old. So I want to see people, this girl, they're not going to have problems that age. My skin health has just gone down, wrinkly eyes last 3 years. I turned 50. So really looking at, all right, who are they showing in their ads? I think is pretty funny. And really looking at before and after pictures. Do I see anything? Like, is there benefit? Now, everyone's different. So we can look at learning, review and results, how it works, red light mask, and LED light therapy. So Omnilux, a company I haven't heard of, I just popped up when I was researching, but LED devices, and we can really work on skincare with this, so they say. Now, Omnilux products have proven wavelengths of light with optimized energy levels, LED phototherapy. How does that work? We can dive into it more. LED emit light to your skin, light photons of specific wavelengths absorbed in cell components, particularly the big M word I'm looking for, mitochondria, triggering cascade of biochemical reactions as explained in the video we can watch. So we can look at these websites, but let's go look at some articles online. Red light therapy is an emerging treatment treating wrinkles, redness, acne, scars, signs of aging. Red light therapy itself means that it's a low level of red light to reportedly improves your skin appearance. And lots of research going on right now. The article says I have to look at what year this is, but there's low laser light therapy. I don't know if you've seen your chiropractor get active release technique with a practitioner. A lot of physical therapists use laser light. So what is this now? A household. They're not the $5,000 lasers that my physical therapist will use, but there's different options. So diving into this article, I'll put in the show notes, but it's supposed to, red light therapy, work as a power plant in your body cells like mitochondria with more energy. So red light therapy is thought to work by acting on the power plant in your body cells, the mitochondria, powerhouse. We want to work on improving the mitochondria as we age, get new ones, get rid of the dead ones. With more energy, other cells can do their work more efficiently doing things as repairing the skin, boosting new cell growth, enhancing skin rejuvenation. Certain cells will absorb light wavelengths and are stimulated to work. Red light therapy may work in skin health to stimulate collagen production, which gives its skin its structure, strength, and elasticity, increase fibroblast production, which makes collagen. Collagen is a component of connective tissue that builds skin, increase blood circulation in tissue, reduce inflammation in cells. For what skin conditions? Wound healing, stretch marks, fine lines, wrinkles, age spots, scars, and damaged skin. All right, but is it effective? Does it work? All these people have different machines out. They're getting cheaper. Are they the same level that the research is showing will benefit these issues? Stretch mark, wrinkle, fine lines, age spots, facial texture. Because I've been using a mask and I really, maybe my skin would be worse if I didn't use it, but looking at the science is what we need to look at. The gold standard of studies determine that if a product is effective, randomized placebo-controlled study, certain number of people with the same range of characteristics get the study treatment or placebo. So that's what we want to look for. Some studies include in comparison to other used treatment. So we can look at that, and looking at published studies using RLT included small number of people, didn't include placebo group. So anyways, you can read all that. I won't read it to you, but that's what we want to look at. What is the studies done on? What are the medical conditions? What is the type of red light therapy is needed? So that's more what I want to look at. Yes, it might help all these different benefits. Seasonal affective disorder. Another study I was trying to find online, PubMed. You can look up red and near-infrared light treatments, reduction, fine lines, wrinkles, skin roughness. Does it do anything? So you can scroll through the study, look at the abstract is easiest. Who is it done on? 136 volunteers, randomized and controlled study, randomly assigned 4 treatment groups, treated twice a week. So this is what we need to look at too. What is the power of the red light? That's what I was looking at on this new red light I got. So what is the potency? What's the minimal effective dose, basically, right? Data collected baseline after 30 sessions. So these people were 4 treatment groups treated twice a week. So 2 times a week, but I don't know how long. Subjects experience improved skin complexion, skin feeling, better skin roughness, measured collagen density. So conclusions that a broadband polychromatic PBM showed no advantage over the red light spectrum. However, both novel light sources have not been previously used for PBM and have been demonstrating efficacy for skin rejuvenation, intradermal collagen increase when compared to controls. So you can look at the studies, you can see characteristics, subject groups, and look at the data before and after the treatment, the light sources we want to look at. So whenever there's a research study, I always like to look at, as we said before, who's it done on? Is it comparison? Is there different control groups, placebo groups? Duration here, 20 minutes, 15, 25, 12, 4 different groups. So we want to look at the treatment dose and duration and the exposure to the red light. Lamp light, medium pressure, low, low, full body, partial body. So treatment position, we want to look at all this data to see, okay, which group had the results. So you can click on here, look at the results, blah, blah, blah. So you can go all through that. So this might show good information to see before and after, if there's differences and what one works. So we can go into that a little bit deeper. So this is a long research study to look at the discussion, and then you can click on the conclusions on here. Right, so RLT, ELT, extended anti-aging, blah, blah, blah. Yeah, so improvements in. So then we can look at, all right, what are some options out there? Some are expensive more than others. What's affordable, but you get what you pay for. So looking at what is the best device, I'd go back and look at this type of research study, which model had the most results. Remember the protocols, we want to look at the length of the red light therapy and dive into, always look at two. Investigator. Yeah, that was okay. So a lot of times I look at who was the study funded by, what were they trying to do? Were they, that was it red light therapy company running it? All right, so Mito red light is one device. There's portable devices. You can check that out. And I find it hard to figure out, okay, how am I going to use this? Here's the information, remote control. Does it have a stand? You have to research into all these items. What do you want? How are you going to use it? Is what I was going to say. I don't see myself sitting there in front of a red light 15 minutes. So what could I do? Can I work at the same time and have it? I usually wake up and go. So if you can get a full panel, that would be pretty amazing. Red light therapy panel. So you got to look at what is your price point. If you want to just starting of a lower budget, if you're more like me and you don't have thousands of dollars to spend on that stuff, what can we do to start? And what is 300 versus 750 versus 1500 Pro? What is the best to get? See, then you're looking at $1,200. So is it beneficial? Am I going to get any results from a little light like this one? And it's only 300. So we want to look at the differences in models. So you can scroll down here, look at the information, targeted body parts, half body, full body, partial body, and look at the pricing. And then we want to look at LED, the wavelengths. So I think this is what I would look at more so and find out, okay, are they all the same? It's just the size. So that is Mito Pro, Mito Red Light. So you can look at that one. So maybe something as this one might be a best model to start with. You can sit on your light or your desk and you can really look at touchscreen, brightness, alarm function. It's just when are you going to use it? If you're doing your face, you need goggles, eye protection. You can't just sit there, look at your eyes. So what's included? And then we want to look at benefits. Healthy skin, overall health and wellness, supporting cellular function, Mito, red light therapy devices, all over the counter class 2 medical devices. Another word you want to look for, medical device, class 2 medical device. Benefits here, relief stiffness, cellular function, relaxation, mitochondria, energy production. All right, higher dose, I've had a few years. This is something that I think they were ahead of everyone else doing, but now there's lots of copycats with the LED amount and then the red. So 630 nm, and they can compare it to other devices here, how much is in it. Okay, so that's what I do is kind of shop around and look at what works. And then frequently asked questions, red light therapy, red light emitting diodes, how do you say that? LED, used to deliver red and near infrared wavelengths on your face, other body parts. Red light provides wavelengths of light similar to sunlight, but without the UV rays or the heat. The mask is made of medical grade silicone. LED lights are attached to it. And so that is looking at the higher dose mask that I'll have. Now, clinically proven to reduce lines. This is what I'm trying to do. And then you just can wear it walking around. Other one, it seems to be lots of masks since then, but you can look at Omnilux. They have the different ones, $395, $395. They're all about the same. So I don't know what's difference of the men versus clear. I guess different design. $395 versus higher dose. How much was that? Higher dose, red light enhancer, $249. So $349. So they're all comparable price, right? It's pretty much $350. So there's higher dose, Omnilux, and then you've got Mito Red Light has a mask too, and for your hair. So you've got lots of options. So their mask is blue light for therapy for acne. intranasal device. Oh, I need that. My nasal passages could use that red light therapy. So that's $199. So lots of interesting stuff out there. So I would check it out, do your research, look at, okay, do I need this? A face mask? Yes. I don't want wrinkles on my face. I don't like the look of my face. I'm wearing glasses and not doing as much videos because I can't stand looking at myself. And that is where I am in my journey. So looking at red light therapy, is it beneficial for you? You can learn more, Mito Red Light. Again, ask me for the discount code. There's always 20% off, 10% or something with a code. So let me know if you're interested. But getting some red light therapy, looking at the science, looking at what is the minimal effective dose? How long do you need to use the red light to help your mitochondria? So looking again, the mechanism of actions, keyword I research, surrounding red and near infrared light therapy, stimulation of mitochondria energy production in the cells. Mitochondria are tiny organelles within the cell. We just did that video on that yesterday, that produce all the energy that our cells and our bodies need. All molecules and atoms absorb very specific wavelengths of light. The specific molecule within the mitochondria that is thought to absorb red and near infrared light, a chemical called cytochrome C oxidase. Cytochrome C oxidase plays absolutely essential role in transferring electrons down electrochemical gradient in mitochondria called electron transport chain. This is what drives synthesis of ATP, is a complex organic molecule considered the currency of energy in the body. So red light therapy is ultimately thought to improve efficacy and speed in the electron transport chain, improving the availability of ATP in the cells and throughout the body. Increases your energy, provide many benefits of red light therapy is used. So that makes more sense, right? The science behind it, you can read that information. You can see the optical window, range of wavelengths, has good information on this Mito red light page. So what is the benefit? What is the minimal effective dose? What is the dose of the red light that you need? And how long do I have to use it? How many days a week? So what is the protocol? Window, primary limited light absorption, wavelengths below, and longer wavelengths. So we want to look at what is the protocol for you to use this. So optical window. All right, so that was my question. And the other thing I would supplement this with is looking at BioCell. That is a collagen production. So you can type in BioCell, look at this collagen generator. So scroll down here. And then I would look at adding True Niagen, brain health, and mitochondria. So if you added these guys in, all the benefits from True Niagen, that is something I would connect with as well into your protocol. So brain health. So looking at skin mitochondria, we want to have a True Niagen or precursor to NAD plus, and collagen production, and using red light therapy and seeing the sunrise and the sunset. So you get that sunrise, different wavelengths, and getting your sauna. I think those are great stacks to do. All right, if you have any questions, let me know. Ask me for the discount code, Coach Debbie Potts, and let me know your experience and how to improve skin health and not have wrinkly face as we get older is my goal, and energy.